So we are going to be presenting a video on tone, how to treat and assess kids with high tone and kids with low tone and how they differ. One way to assess tone in children is using the modified Ashworth scale. This scale measures how much resistance to passive movement a limb has due to tone. Amy, come here. This would be a 0 on the modified Ashworth scale because there's no increase in muscle tone. This would be a 1 on the modified Ashworth scale because it's manifested by a catch with no resistance. This is a 1+ on the modified Ashworth scale because there is a catch and minimal resistance through more than 50% of the range. This is a 2 on the modified Ashworth scale because there's a marked increase in muscle tone. This is a 3 on the modified Ashworth scale because passive movement is difficult. This would be a 4 on the modified Ashworth scale because her limb is very rigid. Another way to assess tone, especially in the lower extremities, is by doing the pendulum drop test. 1, 2, 3, 4, 5, 6. Since Amy's leg beat 6 times, it would be considered a normal tone. 1, 2. Since her leg only beat 2 times, she would be considered to have high tone. Another scale that we can use to measure the tone in a limb would be the Tardow scale. So this measures the amount of resistance that occurs in a limb when moving it as slow as possible for V1, when just gravity does the work for V2, and as fast as possible for V3. So the two numbers that we're going to get a numerical value for spasticity would be R1 when we're moving it as slow as possible. In normal children, it's always through full range. And then R2, I said that backwards, R2. R1 would be for when you're moving it as fast as possible or when they achieve a fatigable clonus, which could occur at V2 as well. So for a normal child, we're going to take an R2 measurement. So Kristen is going to move Amy's arm into elbow extension as slow as possible, and she gets all the way to 0, which means there's no resistance in the limb. So now she's going to measure her R1 value as fast as possible, and in a normal child this should also be 0, which it is. So a 0 would indicate normal because she can achieve the same amount as slow or as fast as possible. Now, if Amy was a child with increased tone in her elbow flexors, when moving it as slow as possible, we could see how far she gets, which there should be a clear catch around 40. Yep, great. So as slow as possible, now we're going to be moving her as fast as possible to find out where she gets that fatigable clonus. And there is a fatigable clonus at 90 degrees. So her numerical value would be 50, indicating that she has increased tone in that limb. One technique to treat children with high tone is relaxation when they're swaddled up, rocking back and forth. This can relax the child and thus reduce the tone. Another way to treat a child with high tone is the same relaxation technique. This one can be used with a little bit older child. Another way to treat children with high tone is by using the RIPS, or the reflex inhibiting patterns. So for the lower extremity, it would be ankle dorsiflexion, knee flexion, hip flexion, and external rotation to move out of synergy, followed by straightening the knee and placing an abductor wedge to take them out of the scissoring extensor synergy. Another intervention that we can do with children with high tone is weight-bearing activities with reaching for a toy, so that they can practice loading their spastic limb and dynamic balance with reaching activities. One intervention for a child with low tone would be bouncing on a ball. It can be used for approximation of the limbs and as a warm-up activity before other therapies to increase the muscle tone. One intervention for a child with low tone would be spinning them in a chair or on a swing, because it practices their vestibular stimulation. Another intervention for a child with low tone would be wheelbarrow racing, because it works on strengthening and approximation of their upper extremity. So there's a lot to know about tone, but hopefully knowing the difference between low tone and high tone can help you select the interventions that are most appropriate to treat your patient. And that's our video! Yay! Alright, so we are going to be presenting a video on tone and how to assess whether children have high tone or low tone, and if so, how to treat them.
I was biting my nose. Stop that!
Okay, ready? Wait guys, we totally should have a blooper section.
Cat therapy.
A great alternative to hippo.